In our Jackson County, in southern Michigan, we have a mixed population which is mainly Medicare, Medicaid.
We have a high prevalence of lung cancer. Over half our patients present with metastatic lung cancer, which is generally incurable.
There's data that shows that in the Jackson area, 35% of the population is actually current smokers.
We have seen before the screening most patients with stage 4 or stage 3 lung carcinoma, which with a very high mortality. Their 5-year survival rate is anywhere from 15% to maybe 20%, 25%.
We felt it was very important to start a program like this because what we were finding, given the demographics of our population, is we were catching disease in the late stages.
For many years at Henry Ford Allegiance Health in Jackson, we've had a thoracic disease site team. This thoracic disease site team is a focus group of physicians and non-physicians dedicated to the management of lung cancer, both in terms of its treatment and in the screening program.
As we developed the program, we wanted to be sure that we had the opportunity for the patient to have a full continuum of care when they came in. We do have a high incidence of no-shows with some of the population that we serve, and some of those are the highest risk populations. So our goal was to make it patient-centered and easy to access.
So they show up for the test, they come with their family, and then once the diagnosis is made, our radiologist, Dr. Parikh, will come out and he'll spend some time with them, reassure them. Obviously there's anxiety associated with the diagnosis. He will show them pictures, he'll show them where the nodule is, and he'll say, hey, don't worry, we have a direct line to a thoracic surgeon.
Sitting down with the patient during this clinic time is extremely important because I want the patients to know that what my lungs look like, what are the findings, is it abnormal or is it normal?
It's phenomenal that Dr. Parikh meets with these patients right then and there, so there's not that lingering tension that they have to go home and wait for however many days to find the results.
I thought, let us just, make a new tradition here. Break the tradition, create a new tradition of creating a lung cancer clinic, lung cancer CT clinic, I would say. By doing it, I had the lung nodule navigator with me. I had a tobacco citizen counseling specialist with me.
As the nurse navigator in the lung screening clinic, I make sure that the patient's physicians are notified of results if they're abnormal right away, so usually the same day, if not while they're still there in the office.
Really, I think that many systems have screening programs or they have certain pieces that are fragmented. The whole role of the nurse navigator is to take that fragmentation and make it so that there's actually someone there who's caring for the full continuum of their care.
The patients now, I think, are beginning to understand, and we're enabling them to take an active part in their care. And if they go home knowing exactly what it is they need to do to get better or what the next step is in the process, I think they tend to be more apt to follow through.
I think the patient's autonomy is preserved throughout. I think that's probably the most important part of this entire process, is that patients understand what's happening and decisions are made with their hand at the whole time.
We like the idea and have always felt that the chance of success is greater if the patient is able to, on the day of their screening study, get the results and proceed to interact with a smoking cessation navigator.
Well, the smoking cessation counselor is a very critical part of our overall process. And with administration, we understand that when you have one moment of opportunity to teach someone, to have that person present is a critical piece of our success.
The one-stop shop in a very, expedited manner really helps people to get the service.
Our plan is to continue to evolve this program to touch more lives. We've demonstrated significant growth. This year we're going to be up to almost 1,100 screens that we're performing, and that's the tip of the iceberg.